But maybe I'll just read out the question and we'll request that maybe in a speech this will be addressed. So the question is, despite the failure to reduce teenage pregnancies, why is the government considering reducing the age of marriage of girls from 18 to 16? Especially on a side note,
who have made it happen. And what a fascinating afternoon it has been. Could I thank very much the presenters for what they've done this afternoon. They've entertained and enthralled us. And I think it's an excellent example of how presentations of such complex findings should be presented. Well done. And please give me a round of applause. And what thought-provoking and fascinating findings there have been. The American ambassador and I have been whispering to each other all through the presentation, going, gosh, gosh, gosh. Think of that. It's been very interesting indeed. I have enjoyed it. It's true that Bangladesh has made very impressive progress towards the Millennium Development Goals. With continued economic growth, more people have been lifted out of poverty, and there has been a substantial decrease in maternal and infant mortality. However, despite the overall health improvements in Bangladesh, the health of slum dwellers in urban areas remains far worse than the national average. And across the globe, as we saw with the rise of the mega cities, urbanisation will throw tremendous challenges over the next 50 years. And that is why it's so important we have in place the strategies and the programmes to address that. Secondly, in the UK, we emphasise that we should not work in isolation. Rather, we need to work closely with our many partners as we do here in Bangladesh today. We have made a global commitment to save 50,000 maternal and 250,000 newborn lives by 2015. And in Bangladesh, we support health and nutrition programs in both the public and the non-state sectors. In our current operational period, UK aid has committed up to £160 million. That's more than 2,000 crore taka to reproductive, maternal, newborn health and nutrition. We want to provide antenatal care to more than 500,000 women and provide safe delivery for 100,000 of them. And this programme includes £38 million, 500 crore taka, over the next 5 years to support the urban poor under our Urban Health Programme. A key component of this is to support USAID's Smile in the Sun programme, and other partners, of course, include Married Stoves Bangladesh and the Bharat Manoshi programme. The goal of these programmes is to strengthen the network of non-government primary healthcare suppliers and to strengthen their relationships with government authorities. We also partner with UNDP through our Urban Partnerships for Poverty Reduction, and through this programme we are providing £65 million for the next 7 years, with the aim of improving the livelihoods and living conditions of 3 million poor people in 23 major cities across Bangladesh. We want poor communities living in urban slums to get better access to clean water, better access to sanitation and improved drainage, of which we've just heard. The survey, I think you agree, has revealed very strong results in many health indicators for which Bangladesh should be proud. The average number of children born to women has dropped, the use of contraceptives, antenatal care and skilled birth attendance shows a significant improvement since the last survey in 2006. But as always, there are areas where more effort is needed in the urban areas. For example, there has not been enough progress in preventing babies dying soon after birth. We need to do more to reduce the number of children who still don't get enough quality food to eat. And we want to ensure that women and men have a full choice of family planning methods, including long-term methods. We want to ensure that the most vulnerable people in Bangladesh, the extreme poor, those living in slums, and women and girls have access to quality primary health care at a price that they can afford. The UK government is committed to supporting Bangladesh in its efforts, and we hope that we will see the government of Bangladesh continue to address these areas as a matter of priority.
Thank you, His Excellency Mr. Gibson, for your valuable speech. I would now like to invite His Excellency Mr. Dan W. Muzana Ambassador of the United States of America to Bangladesh, and special guest of the seminar to deliver his speech.
Minister Nasim, High Commissioner Gibson, Senior Secretary Hussein, Secretary Niazuddin, Additional Secretary Badruddooza, and you, all of you. You are the engines of Bangladesh's health revolution. Assalamu alaikum. Namaskar and good evening. An empty bed. Many empty beds. It was beautiful. So beautiful. As I toured the diarrhea ward of an urban hospital a couple of months back, I was amazed to see so many empty beds. The doctor showing me around said that when I lived in Bangladesh 15 years ago, the ward was then crammed with multiple patients in each bed and across the floor and in the hallways. And many of them would have died. But no more. In a different hospital, this time in Chittagong, the doctor guiding me through the pediatric ward pointed out a 10 or 12-year-old boy. The doctor, knowing of my earlier stay in Bangladesh, said that 15 years ago, that boy suffering a respiratory ailment would not have been in the hospital. Oh, I said, why not? The doctor's quick response was that then the boy would have died before receiving treatment. But no more. I share these two recent vignettes to put a human face on the encouraging statistics that we saw over the past couple of hours. The survey reflects the historic progress Bangladesh has made in slashing maternal and child mortality rates and in enabling Bangladeshis to have the family size they want by accessing voluntary family planning. I was amazed to learn from this survey that 70% of urban poor couples use contraception, more than any other demographic group in Bangladesh. This survey is so important because it documents success. It shows progress and changes in the choices people are making when they seek health care. It also reveals the gaps that need to be addressed to continue to drive down morbidity and mortality. The survey results make clear the success of Bangladesh's all-inclusive approach to health care, whereby government and NGOs and the private sector and the development partners all work together to bring needed services to the people, which is especially important for the urban poor. This all-inclusive approach to health care, of course, raises the challenge of sustaining high-quality care with so many independent actors. As the steward of quality health care, the government seeks to strengthen its ability to provide regulatory oversight of private sector health care providers. I hope Bangladesh is proud of its progress in improving the health of the urban poor, as documented by this survey. This survey also identifies those areas where more work remains to be done. Still too many children of the urban poor die. Still half of the children of the urban poor are stunted in their growth, due largely to malnutrition. Still, nearly 2/3 of deliveries among urban poor mothers are done by non-skilled attendants, creating greater risks for both the mothers and their newborns. These are challenges, indeed serious challenges. But now, thanks to this survey, we better understand these challenges, and now we can better focus our efforts to overcome them. I am pleased that America and the United Kingdom, through USAID and DFID, co-funded this survey, which was conducted under the authority of the Bangladesh Ministries of Health, National Institute of Population Research and Training. The International for Diarrheal Disease Research Bangladesh and Measure Evaluation provided valuable technical assistance to the survey, which was carried out by the Associates of Community and Population Research. Today, we contemplate the results of this survey. Today, we applaud the achievements and the successes. Today, we assess how best to tackle the remaining challenges. And tomorrow, all of us, government, NGOs, private sector, development partners, including especially America and the United Kingdom, tomorrow we are all back in the trenches working to advance the health and well-being of the urban poor. Essential to the success of these efforts is close and effective collaboration between the Ministry of Local Government, which is responsible for providing health care in urban areas, and the Ministry of Health and Family Welfare. Thanks to this survey, we are able to work smarter than ever as we better understand the challenges of helping the poor, of helping the marginalized people live healthy and productive lives, so that they too can play their part in building middle-income Bangladesh. So they too can play their part in building Shonabata. Thank you.
Thank you, His Excellency Mr. Mazana, for your informative speech. May I now request Mr. M. Niazuddin, Secretary, Ministry of Health and Family Welfare, and special guest of the seminar, to deliver his speech.
Assalamu alaikum and very good evening. Respected Chair, Honorable Chief Guest, Honorable Minister of Health and Family Welfare, Mr. Mohd Naseem, respected special guest, Mr. Senior Secretary, Mr. Munjur Hussain, special guest, Dr. Majina, His Excellency Dr. Majina, special guest, His Excellency Mr. Robert W. Gibson, distinguished participants, ladies and gentlemen. First of all, I would like to thank the presenters. You have seen there were 9 presentations, but we have enjoyed the presentation because of the style of the presentation and also the information of the presentation. And I would like to thank the Newport and the employees and the officers of the Newport for his very excellent job they have done with the help of the development partners and also US aid and UK aid. And I also like to thank US aid and UK aid for giving Nepal, giving financial and technical help to the Nepal. And from the presentation, we have come to know, I think, about all aspects of health-related items and aspects. And we have come family planning, we have come the health status of the slum and the urban people, and we have also come to know about the breastfeeding condition of the urban people and the slum people. And this is, I think, excellent job you have done. And this is also very important for the Ministry of Health and Family Welfare. And you know that in the meantime. And we are going to initiate the next sector program in after 2016. So it will help us for making another very good sector program to address these challenges. There are many success stories in the health sector, and you have know that in the meantime we have achieved MDG 4. And we are very much close to achieve MDG 5. Even there are many challenges in the health sector. We are spending very little money in the health sector. Our budget is very small. Our budget in the health sector is not sufficient. We are only spending $29 per year per person in Bangladesh. This is, I think, lowest in the Asia countries of Asia. So, in spite of that, we have very good success story in the health sector. I would like to request development partners and the other agencies just to give us support to just technical and financial support to make a very good sector program for the next year to address these challenges. And you have seen there are many challenges also in the urban area. And we have seen in the urban area, and especially I think the misconception about the slum people, especially family planning, contraceptive aids and maternal mortality, child mortality. But I am very much happy to know that the contraceptive rate is higher, even higher than the urban people, those who are living in a very good position. But we have to look, we have to see the other areas of our country, especially our Sylhet region and Chittagong region. But I think with the help of the donor agency, NGO and government, we have to work all together just to address these challenges. I think this survey and this study, it will help us to make a very good sector program for the next sector program, and we will be able to achieve MDGs and other targets also. With these few words, I would like to thank all of you present here. Thank you very much. Thank you all.
Assalamu alaikum and good evening to you all. Mr. Chair, Chief Guest, Mr. Muhammad Naseem, MP, Honorable Minister of Health and Family Welfare, a special guest, His Excellency, Mr. Robert Gibson, the British High Commissioner in Bangladesh, a special guest, Mr. Dan Mozaina, US Ambassador in Bangladesh, a special guest, Mr. Niazuddin, Secretary, Minister of Health and Family Welfare, distinguished representatives from development partners, distinguished guests, and distinguished presenters. I must congratulate the presenters. They have very succinctly analyzed what is there in the survey, and in a very nice way. And they have captured a large amount of data and have shown intertemporal difference in the health sector in the urban areas of Bangladesh. And that gives a rosy picture, I must say. And that rosy picture says that Bangladesh is just proving that it is competent and capable to achieve demographic transition. And this also shows that the country has moved in terms of economic growth. Unless economic growth had been impressive, we could never attain this achievement. And that is what the theorist of the demographic transition, Mr. Professor Frank Noteston of Princeton University has said some 70 years ago in 1946. We have been successful, we are going to be successful. And this also shows that Bangladesh is going to get the dividends of demographic change, which means that it is on the trajectory to become a middle-income country, maybe in a matter of a decade. So we must be very happy from these analyses. Distributed cooperatives is responsible for all rural and urban local government matters, and hence government division is responsible for coordination of all local government institutions or LGIs, including city corporations. The local government, Paurasabha, that is municipality, and city corporations Act of 2009 clearly assigned responsibility to urban health services. For treatment of patients, they establish maternity centers, and they can also take measures needed to or for these However, we must say that we have many challenges. We at the Ministry of Local Government shifted government role from the direct provider of services to purchaser of services from a range of providers, including NGOs. Our linkage with the Ministry of Health at operational and technical level have not been clearly formalized, for which we need some policy regime. Acknowledging that the boundaries of the Ministry of Health is Service Delivery Department, etc., DGHS, DGFP, and the Ministry of Local Government and respective city corporations in the sector are not entirely clear, and thus that needs revisiting. There seems to be more scope to address intersectoral coordination and partnership issues within the prevailing health policy environment. We strongly believe that establishing a permanent governance regime to stimulate demand for the provision of urban services, especially for the poorest and the most vulnerable people, will be beneficial to them. We have much work to do. We have to tackle a lot more challenges in the future. The Bangladesh Health Survey and other national and regional structures will help us know where programs are needed most and where investment of fiscal resources should be made in the future to make a big difference. Distinguished participants, join me in thanking NIPOT, ICDW, and Measure Evaluation for working so hard to complete the 2013 Bangladesh Urban Health Survey and to present this vital information to this evening. And finally, I must also thank the AID and DFID for their financial assistance and technical support for conducting this important survey. Thank you all for your patient training.
Thank you, Mr. Manzoor Hussain. Senior Secretary, Local Government Division, for your enlightening words. I would now like to take the opportunity to invite the chief guest of the Dissemination Seminar, Mr. Mohammad Nasim, MP, Honorable Minister, Ministry of Health and Family Welfare, Government of People's Republic of Bangladesh, to share his views with us.
Bismillahirrahmanirrahim. Mr. Chairperson and Director General of Reports, special guests, distinguished representatives and development partners, participants, ladies and gentlemen, Assalamu alaikum, good evening. It is indeed a great pleasure for me to be here at the dissemination of preliminary results of Bangladesh Urban Health Survey 2013. The government of Bangladesh recognizes its solemn obligation to ensure the health of our citizens. We are committed towards a well-coordinated, extensive effort and initiative implemented by our government. The rural partners and the people at large of the expanded development program. We are working to ensure quality and equitable care for all citizens of Bangladesh by improving access to and utilization of health, population and nutrition services. Ladies and gentlemen, we value the balanced urban health survey. Results since this important survey helps us understand how well we are meeting our obligations, especially in slums and non-slums in city corporations. Without, we would have great difficulty judging whether we are successful. I am very happy to learn that Bangladesh has made remarkable achievement in the last 7 years. The intra-urban equality between slums and non-slums in health services utilization has declined. More couples in slums are using family planning methods, and last 7 years the use rate has increased by 11% points. Both brings more good news. Total fertility rate has declined and has reached replacement level fertility or below in slum and non-slum urban areas. More women are getting recommended for internal care disease and giving birth with the assistance of skilled birth attendants. But the news is not all good. We still have challenges. There is inequality between slums and non-slums in coverage of 4 or more attendant care services. Use of skilled birth attendant for delivery and standing of children. We have to take timely and effective program measures for addressing these challenges. We are committed to providing adequate health care for the people of Bangladesh so the future will hold promise our children and grandchildren. I would like to explain that at this crucial juncture in our collective journey towards achieving goal of HIV and SDP, much will depend on the speed and quality of our efforts. I urge all concerned, both governments and government officials, to find ways and means for better program implementation and to identify priority activities for addressing the critical issues of improved health care. Ladies and gentlemen, I make these promises assured in order to ensure health services to every citizen of our country. Our government will evaluate and adjust program and policy according to the demands of this time. I also assure that the recommendation of the workshop will be given due attention by our governments. Ladies and gentlemen, I would like to take this opportunity to thank you, Your Excellency Mr. W. Medina, Ambassador to the United States of America in Bangladesh, and extend my gratitude to the government of USA for financial support and technical assistance for this excellent endeavor. I also thankful to Dr. Karen Slam, team leader of DFID, for attending the seminar and providing financial assistance in this survey. Distinguished participants, before I conclude my speech, I express my sincere appreciation to the government of non-government officials and development partners for taking the initiative to hold such an important workshop. I'm sure you all joining in encouraging individuals and agencies, if possible, for carrying out this service, for the contributing such valuable and much needed part of our national program. Distinguished participation, journey, thanking plan, bring up my history, report, ICT Valley, and evolution of University of North California, USA, for working hard to complete the survey and to present this vital information today. Ladies and gentlemen, today we are moving towards achieving universal health coverage in Bangladesh. One step closer to fulfilling the dream of our Honorable Prime Minister Sheikh Hasina for having a healthy and prosperous Bangladesh. With this work, I would like to conclude my speech. But before I conclude this speech, my good wishes to Honorable Ambassador of America, Mr. Darl Mazina, because he is leaving Bangladesh very soon. After completion of his tenure in Bangladesh, he is very much known to Bangladesh people. He is very much popular in Bangladesh. Everyone knows his name, D. Mazina. He is a good orator. I first heard his speech in this country.